Bismillahirrahmanirrahim. In this lecture, we will discuss about the tissue processing. That is one of the important topic of the histotechnique. So, what is tissue processing? Any treatment with a fixed tissue required to impregnate it with a solidifying or supporting medium to facilitate its fine sectioning for microscopic examination is termed as tissue processing. Usually, it is done in automatic tissue processor. These are the four basic stages of the automatic tissue processor or tissue processing. The first step is the completion of fixation, then dehydration, then dealcoholization or clearing, and then impregnation, also known as infiltration. The specific objective of this topic is the tissue processing is the heart of any tissue section, which will be cut adequately only if the tissue is properly preserved and processed. The study of this topic is to understand the course and final details of tissue processing so that excellent sections are obtained. This is the first step of the tissue processing, that is known as completion of fixation. So already fixed tissues are once again fixed in the tissue processing schedule. 2 or 3 jars are placed in the first two steps, and this process is known as completion of fixation. The second step is the dehydration, which means that we remove the water from the tissue. This process is known as dehydration. There are two types of water present in the tissue, one imbibing from aqueous fixative solution, and secondly the water present in the tissue, that is also known as interstitial fluid or tissue fluid. So the problem is when a supporting medium like paraffin wax is used for impregnation and embedding, if water is present already, it is not miscible with paraffin wax and we cannot properly infiltrate the tissue. So the removal of water is a must before infiltration and impregnation. So there are two mechanisms of dehydration. The first one is hydrophilic mechanism, the second one is dilution mechanism. In hydrophilic mechanism, the dehydrating agent like ethanol show an affinity for water and so attract it out of the tissue. The affinity is due to the polar characteristics of the water molecule and the dehydrating agent used. In the dilution method, it is very simple. Biopsy is transferred from one jar to another of the dehydrating agents which dilute out the water, and finally the tissue becomes completely free of water. The chemicals which are used for the purpose of dehydration is known as dehydrating agents. So various dehydrating agents can be used in histopathology laboratory. The best of all is ethyl alcohol, while we can also use methanol, acetone, diazone, and isopropyl alcohol for dehydration purpose. We will discuss ethanol as a dehydrating agent because it is one of the best dehydrating agent. Ethanol is also known as ethyl alcohol, and it is obtained by the process of fermentation of sugars. There is a biochemical change brought about by certain microorganisms like bacteria or yeast. So there are some merits associated with ethanol and also some demerits. For example, ethanol is an excellent dehydrating agent and shows a strong affinity for water. It is non-toxic, but it is costly and bear high excise duty. It is quicker in action, but has hardening effect on tissue. So it is used in graded strength, usually beginning from 70%. Then transfer the tissue directly from formalin to higher strength of alcohol, that is 85 to 95%, is risky because it will lead to distortion of the tissue. In case of delicate biopsies like brain embryo, dehydration should be started from 50% alcohol. Normally ethanol obtained by supplier is not 100% pure and contain different quantities of water, so it will lead to poor dehydration. To check the purity of ethanol, we can just add copper sulfate dehydrated form to the water, to the ethanol. If it changes the color, it indicates that water is present and it is not absolute ethanol. The next step is clearing. So clearing is simply the removal of the dehydrating agent. So most of these tissue have similar refractive index to that of protein, therefore the tissue is left translucent. A clearing agent is required when the dehydrating agent is not miscible with the impregnating medium. It is essential for clearing agent to be miscible both in dehydrating agent as well as impregnating and embedding agents. One of the commonly used clearing agent is xylene. So it is an organic compound and belongs to the class of aromatic compounds. It is good clearing agent and increases the transparency of the tissue biopsy. It is comparatively less expensive but highly flammable. Prolonged immersion of tissue more than 3 hours make the tissue hard and sectioning is difficult to perform. It is also cause brittleness of the tissue. Tissue block 3 mm in thickness are clear in 15 to 30 minutes. Uh, Materials like brain lymph nodes become brittle if immersion is prolonged. Such biopsies are usually cleared with chloroform. When dehydration is not complete and biopsy is kept in xylene jar, xylene becomes milky. So these are some advantages and disadvantages of the xylene. The last step of the tissue processing is impregnation or infiltration. So it is the complete removal of clearing agent by substitution of the paraffin wax or any such similar impregnating media. Impregnation with wax takes place in oven heated to 55 to 60 degrees centigrade depending upon the melting point of the wax used. Frequent check of the temperature of paraffin bath is required since temperature 5 degrees above the melting point of the paraffin will cause tissue shrinkage and hardening. So most commonly used impregnating agent is paraffin wax. There are some properties of the paraffin wax. For example, it is easy to prepare, large number of tissue blocks is comparatively impregnated in a very short time. It requires minimum supervision. It is cheaper than other impregnating medias, and during staining there is very little difficulty than other media. While using the paraffin wax, following points should be considered. The first one is this wax must be free of dust, grit or any foreign matter. It should not contain water because it will cause the wax to crystallize and turn white. The wax has to be filtered before use by using ordinary filter paper. Higher melting point waxes are hard to ribbon. For impregnation, the wax oven has to be kept at a high temperature, making the tissue hard. Too low melting point wax may not be hard enough to support the tissue during cutting. If the wax is overheated and remain in that state for a long time, it tends to crystallize and become useless. Following are the factors influencing the rate of impregnation, the size and types of tissue. For example, if the size of the tissue is large, it will take longer time for impregnation. Similarly, if it is a hard biopsy, it will also take longer time. The clearing agent employed and the use of vacuum embedding oven will decrease the time of impregnation. Following is the schedule for the automatic tissue processor. So the first jar is the fixatio, which is used for 1 hour. Second jar again fixatives for 1 hour, and this step is known as completion of fixation. Then we immerse the biopsy in 70%, 80%, 90% and absolute alcohol for different timings, and this whole process is known as dehydration. And then the tissue is immersed in xylene 1 and xylene 2 for 1 hour to complete the clearing process, and then the tissue is placed in molten wax, that may be paraffin wax, for 2 hours in one jar, 2 hours another jar, and 2 hours another jar, and then the temperature is lowered. So this whole process is known as impregnation. So this is all about the tissue processing, and next we will continue with the cutting of the tissue, that is known as microtomy.